Consumer-generated data by itself will not go far. I mean, we can track how much we weigh, what our blood pressures are, and so on and so forth, and it's personal gratification if I lost a pound or two. When we combine it with electronic medical records, that's when the game starts. And it's important for someone like me who's lived across 5 countries that my records are all over the place and there's no continuity until I speak up. And I think that becomes more and more a challenge as you look across the socioeconomic divide we live in and work across.
I think from an R&D perspective, consumers-generated data is going to become more and more relevant and important as what we define it to be changes. So as the data evolves and becomes more complete and really paints a picture of the patients, I think that's going to be really helpful for pharmaceutical companies to target new therapies specifically to subsegments of patients. It is a real opportunity for consumer tech and pharma companies to really collaborate and partner. You're really moving outside of traditional pharma's wheelhouse as you get into some of these new and emerging technologies. I think you've seen companies start to get into diagnostics to some extent, and this is going really far beyond that. And I think we're starting to see some of these trends and these partnerships and collaborations start to develop.
Pharmaceutical collaborations have evolved to the point where now they leverage data that wasn't accessible before. Companies can take advantage of new forms of evidence to support drug value on both the R&D and the commercial side. For example, in R&D, working with patient advocacy organizations, companies can use that information to design trials that reflect real patient need versus strict clinical outcomes. On the commercial side, new data is available that can show how patients respond to a therapy outside of the clinic in the real world, which helps purchasers and government plans make better decisions about which patients get which medicines.